Have you ever looked at the foam on your toothbrush after brushing your teeth? If you've ever seen that pinkish tint, that small blood stain mixed with toothpaste, and thought, that's probably normal. I need to tell you something important today. That silent normalization might be costing you your oral health every single day. My name is Alex, and today I'm going to show you something that took me years to truly understand. Something nobody clearly explained to me. Not in school, not at the dentist's office, not in any video I ever watched about oral hygiene. Because brushing your teeth every single day is absolutely no guarantee that your gums are actually healthy. And I'm going to prove that to you right now. It all started in a way I didn't take seriously for a very long time. I brushed my teeth twice a day. I used mouthwash. I did what most people do. And yet, there was a problem I kept pushing under the rug month after month after month. The first sign was bad breath. Not occasional bad breath. Constant bad breath. I would brush my teeth in the morning and just a few hours later that feeling would come back. I tried everything. Mints, strong gum, alcohol-based mouthwash, coffee, anything that could mask that odor for a little longer. And it worked. For a few hours, it worked. But the problem was that I was only hiding a symptom. I wasn't addressing the cause. Not even close. The second sign came even more quietly. A mild sensitivity when chewing harder foods. It wasn't pain. It was just a quick discomfort that appeared and disappeared. I ignored it because it wasn't something stopping me from eating or living normally. It was just unpleasant. Easy to explain away. And then came the third sign, the one that actually scared me. I was looking at myself in the mirror one day and something seemed different. My teeth looked larger than I remembered. That strange feeling of thinking your teeth have somehow grown. And that's when I realized what was actually happening. It wasn't the teeth that had changed. It was the gums that were receding, slowly. Silently, millimeter by millimeter over the course of months, without intense pain, without any alarm, without any obvious sign that something serious was happening beneath the surface. And when I connected all those signs, the bleeding, the bad breath, the sensitivity, the recession, I realized they weren't isolated events. They were all parts of the same process, a process that had a name. Chronic periodontal inflammation. Here's something that most people never stop to think about. Brushing your teeth is not the same thing as taking care of your gums. That sounds obvious when you say it out loud. But in practice, almost everyone treats these two things as if they were identical. As if the act of running a toothbrush across your teeth is enough to keep the entire oral environment healthy. It isn't. The mouth is an ecosystem. It has layers. It has depth. It has regions that a toothbrush simply cannot reach with the quick, habitual motion most people use when they brush. There is a space called the gingival sulcus. It's a small pocket that sits between the tooth and the gum line. That's exactly where the most dangerous bacteria tend to settle and multiply when hygiene isn't done correctly. And here's the problem. A regular toothbrush, used in a regular way, barely grazes that region. Now imagine that happening twice a day, every single day, for months and years on end. Bacterial plaque keeps accumulating in that region. The body detects that buildup and starts reacting with inflammation. The gum becomes redder, more swollen, more sensitive. And when you run a toothbrush over it, it bleeds. And what do most people do when their gums bleed while brushing? They slow down, they avoid that area, or they simply ignore it and accept the bleeding as a normal part of their routine. That is exactly the opposite of what should be done, because the bleeding is not a sign that you're brushing too hard. Most of the time, it's a signal that the tissue in that area is inflamed and needs attention. It's the body saying, something is wrong here. Something has been building up for a long time. Periodontal disease is considered by many specialists to be one of the most underestimated conditions in modern health, not because it's rare, Quite the opposite. It's extremely common. Studies suggest that the vast majority of the adult population experiences some degree of gum compromise at some point in their lives. The problem is that it progresses silently. In its earliest stage, called gingivitis, the inflammation is confined to the surface gum tissue. It's completely reversible. With the right care, the tissue can recover fully. But because the symptoms are mild, occasional bleeding, slight sensitivity, intermittent bad breath, most people don't act during this window. They wait. And while they wait, the condition advances. When the inflammation progresses without being addressed, it moves deeper. It begins to affect the periodontal ligament, which is the structure connecting the tooth to the bone. Then it starts compromising the alveolar bone itself, the bone that holds the tooth in place and gives it stability. And this entire process rarely causes intense pain in the early stages. That is what makes periodontal disease so treacherous. It destroys support structure without warning you with sharp, obvious pain. By the time the pain becomes significant and impossible to ignore, the damage is usually already extensive and harder to reverse. Gum recession is one of the most visible consequences of this process. When the gums pull back, the root of the tooth becomes exposed. That region is far more sensitive than enamel and also far more vulnerable to bacterial attack. Teeth start looking longer, visually become more sensitive to heat and cold, and are structurally less protected than they should be. And there's something that very few people associate with all of this. Persistent bad breath. The unpleasant odor that doesn't go away with brushing or mouthwash often doesn't come from the tongue or from food. It comes from the intense bacterial activity happening inside gum pockets. The anaerobic bacteria that live in those regions produce volatile sulfur compounds as a byproduct of their metabolism. Those compounds are what generate the characteristic odor of periodontal halitosis. No mouthwash truly eliminates that odor because it isn't on the surface, it's coming from within. There's a very interesting psychological phenomenon that happens with our health. When something bad happens gradually and progressively, our brain tends to recalibrate what normal means. What would once have been perceived as a warning sign starts being treated as just part of the routine. That's exactly what happens with gum bleeding. The first time the gums bleed while brushing, it might generate some concern. But if it happens every week, every brushing session, for months on end, it stops feeling urgent. It becomes just the way it's always been. It becomes background noise that gets filtered out completely. The same thing happens with bad breath. The person starts carrying mints and gum in their bag, not as something unusual, but as a regular part of their personal hygiene routine. It becomes such an ingrained compensatory habit that the original cause is completely forgotten along the way. The symptom gets managed, the problem never does. And the same thing happens with sensitivity. Oh, my teeth are just sensitive. They've always been like that. But have they always been? Or did they gradually become more sensitive as the gum slowly receded and exposed more the root over time, month after month, without anyone noticing the change? This normalization process is dangerous because it removes urgency. And when there is no urgency, there is no behavioral change. And when there is no behavioral change, the condition keeps advancing quietly in the background. The good news is that the opposite is also true. When a person starts identifying these signs for what they truly are, alerts from an active inflammatory process, the urgency returns. And with it, the motivation to actually do something about it before the damage becomes harder to address. After understanding all of this, the inevitable question is, what should you actually do? And here I need to be honest with you, there is no magic bullet. There is no single product that, on its own, will resolve periodontal disease in a week. Anyone promising that is misleading you. What does exist is a set of practices applied consistently that can interrupt the progression of inflammation and allow the tissue to begin recovering gradually over time. The first thing to look at is your brushing technique. Most people brush their teeth using a horizontal back and forth motion across the tooth surface. That technique is insufficient for the gum line and can actually cause enamel abrasion over time. The technique recommended by most periodontists involves positioning the brush at approximately a 45-degree angle toward the gum line using gentle circular or vibratory motions. The goal is to clean not just the visible surface of the tooth, but specifically the area where the tooth meets the gum. That one small detail makes an enormous difference in how effectively you remove bacterial plaque from the most critical region of the mouth. The second thing is correct flossing. Most people use dental floss in a way that simply isn't effective. They slide the floss between two teeth up and down and consider the job done. But dental floss exists to clean the lateral surface of each individual tooth and the entrance to the gingival sulcus. The correct technique involves curving the floss into a C shape around each tooth, sliding it gently just below the gum line and using up and down strokes along each surface. This removes the bacterial plaque from regions the toothbrush cannot adequately reach. If flossing causes significant bleeding every single time, that is not a sign that you're doing it wrong or that your gums are naturally sensitive. Most of the time, it's a sign that the gum is inflamed in that area and needs consistent attention, not avoidance. The third thing is broader bacterial control. There are complementary hygiene strategies that help reduce the overall bacterial load in the mouth. Tongue scraping, the use of oral irrigators to reach deeper regions, and mouthwashes appropriate for periodontal conditions are all tools that can complement brushing and flossing effectively. But the important thing to understand is that none of these tools replaces the others. They work together as a complete system, each addressing a different layer of the problem. And the fourth thing, perhaps the most underestimated factor of all, is consistency. Bacterial plaque begins forming again just a few hours after brushing. That means oral hygiene isn't an isolated event. It's a daily practice that needs to be performed with quality, not just with frequency. Brushing poorly twice a day for years produces worse results than brushing correctly once a day. Not because frequency doesn't matter, but because the quality of plaque removal is the most critical variable in the entire equation. Consistency applied correctly is what actually changes the environment of the mouth over time. There's also a dimension of periodontal health that extends far beyond the mouth. In recent years, science has been accumulating evidence that chronic gum inflammation does not stay confined to the oral cavity. The bacteria present in periodontal pockets can enter the bloodstream and travel to other parts of the body, triggering inflammatory responses in tissues and organs far removed from the mouth. Research has associated untreated periodontal disease with conditions including cardiovascular disease, diabetes, pregnancy complications, respiratory conditions, and even cognitive decline. The mouth is not an isolated island in the body, it is connected to everything. What happens there affects what happens everywhere else. This does not mean that periodontal disease directly causes all of these conditions. Science is still investigating the exact nature of these relationships and how deep they go, but it does mean that treating gum inflammation as something irrelevant, something merely cosmetic, something to deal with later, is a completely mistaken perspective that can have consequences far beyond a sore gum or a stained smile. Oral health is systemic health, and when the gums are chronically inflamed, the entire body remains in a state of continuous immunological alert. That consumes resources. That creates ongoing strain throughout the entire system. The body is always fighting a battle it shouldn't have to fight. If you've made it this far into the video, something in this conversation resonated with you. Maybe you recognized one of the signs I mentioned. The bleeding you've already normalized. The bad breath you try to mask every single day. The feeling that your teeth look longer than they used to. The sensitivity that has been quietly growing without you ever connecting it to your gums. And if you recognized any of those things, you need to know that the best moment to act is before the process advances any further. Periodontal disease responds very well to early intervention. Gum tissue has the capacity to recover when inflammation begins to be controlled correctly and consistently. But that window of opportunity keeps closing as bone involvement progresses and deepens. The longer the wait, the narrower the options. So what can you do starting right now? Stop ignoring the signs. Bleeding, persistent bad breath, and sensitivity are not normal. They're not just the way your mouth is built. They are warnings from your own body. Signals from a system that is trying to get your attention before the situation becomes significantly harder to address. Revisit your hygiene technique. Often small adjustments in the way you brush and floss produce visible results within just a few weeks of consistent practice. The change doesn't have to be dramatic to make a real difference in the environment of your mouth. Seek professional guidance. A periodontist can evaluate the current stage of your condition and indicate the most appropriate path forward for your specific situation. Don't wait for intense pain to schedule an appointment. By that point, the situation has usually already advanced significantly beyond what early care could have addressed easily. And above all, commit to consistency. Periodontal recovery doesn't happen in days. It happens over weeks and months of correct and continuous care applied day after day without interruption. That's not a discouraging fact. It's an empowering one. Because it means every single day you choose to care correctly is a day you're actively rebuilding the foundation of your oral health. I left in the first link in the description a practical guide on periodontal health that will walk you through a detailed method of gum care. It's a resource designed specifically for people dealing with bleeding, bad breath, or gum recession who want to understand how to interrupt this process in a practical and accessible way before it requires more aggressive and costly intervention. It's absolutely worth checking out right now while the situation can still be meaningfully improved with the right habits and consistent daily care. You'll also find in the pinned comment of this video information about a natural periodontal care method that has helped many people reduce bleeding, improve their breath, and protect what can still be preserved before the damage becomes harder to reverse. If this video opened your eyes to something you may have been quietly ignoring, share it with someone you know who might be going through the same process without realizing it yet. Bleeding gums, bad breath, and sensitive teeth are things many people suffer with in silence, and they never connect those symptoms to a treatable, addressable cause. Sharing this could genuinely make a difference for someone close to you. And subscribe to the channel because in the upcoming videos, I'll keep exploring oral health topics that go far beyond basic brushing. We'll talk about nutrition and gum health, about natural ingredients with scientific evidence of anti-inflammatory action, about how to evaluate your own periodontal condition at home before it becomes an emergency, and much more. Take care of your mouth. Take care of your health, because they are not two separate things, and they never were. See you in the next video.